95% of cervical cancer, it is due to high risk sexual behavior in terms of prevention. Right? Avoid risk factors.
Yes.
As much as possible. If your partner is risky, get rid of that partner. Right? Yes, of course. Cervical cancer. It is prevalent, however, it is very easy to diagnose. Right? What we can do in diagnosing that, it's a screening test. Do a Papsmear. Once that Papsmear shows that there's something abnormal going on, right? You visit the OBGYN. That OBGYN now will actually stage you, right? Staging is very simple, very, very simple, right? Once you get the stage, then you move on to treatment.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels, and in office with me today is Dr. Shane Papsmear. Welcome to the show.
Thank you.
So, Dr. Papsmear is actually a good friend from back in university, right? So I actually know Dr. Papsmear way before medical school, and actually I know that he's very passionate about medicine and gynecology in particular, right? So he studied at the University of the West Indies, and he is now specialized in gynecology, and he's actually a proud KC old boy. Good, alright? And he also does different voluntary and charity stuff, including sports medicine.
Yes.
Alright. But today I want to focus on cervical cancer, because it's actually a topic that he's actually interested in and actually seen increased cases in, especially the young population, and just wanted to take this opportunity to discuss cervical cancer with him today. Alright? But Dr. Papsmear, before we get into this whole cervical cancer, gynecology, what are the different diseases that they manage in gynecology?
Right. So, in gynecology, right?
Yes, gynecology. Obstetric
No,
gynecology.
as it were there. So, it's gynecology. So usually, right, it's the fields are separated. It's obstetrics and gynecology.
Yeah.
Right. But since we are here today to speak about cervical cancer,
Yes.
right, let's just zone in on the gynecological aspects of this specialty.
Okay.
As you know, the female anatomy, they see cases or cancer may develop in any area of the female anatomy.
Yes.
So, as a separate and apart from cervical cancer, right, there's ovarian cancer,
Yes.
there's uterine cancer, right, so on and so forth.
Okay.
Outside of cancers, there's ectopic pregnancies, which can be sometimes very prevalent in our society, and vulval cancer. So as I say, when it comes down to the female anatomy, female may develop cancer in all those regions, because that cancer really develops, takes to develop, right, in glandular structures.
Okay.
Right, within the female anatomy, right, there's a lot of glands. So there are the glands in the uterus, the glands in the ovaries, glands in the cervix also. That's here.
Alright. So let's focus on the cervix factor. So cervical cancer. What exactly is cervical cancer? So the cervix is which section of the female reproductive? So, I want to make it simple for the person that can understand.
Yes. I do plan to make this interview
Simple.
very, very simple.
Right, for the general
For the layman, because these interviews aren't really done for doctors.
No, they're done for the public.
Actually done for the public.
Alright.
So the cervix, a lot of persons will describe it as the neck of the woman, right? Or it basically sits at the top of the vaginal vault,
Okay.
right? So that's where the cervix lies anatomically, and it does from time to time can cause issues.
Okay.
So if you want us to go now straight into
What are some of the risk factors in the general public? So I want to know what are some of the things that persons should avoid, the risk factors for
So the risk factors for cervical cancer,
Yes.
right? They're not few, but there are risk factors that we need to take into consideration, right? So they'll tell you that risky sexual behavior,
Okay.
right? Times gone by, you say, okay, a female that has many sexual partners,
Yes.
usually male, but no, in this day and age, it could also be females.
Oh.
So risky sexual behavior, right? At early age of coitarchy, meaning a female who starts having sex at a very young age, right? Also, a female that's with a man that has very risky sexual behavior. So yes, this female may, okay, she's with this one partner,
Yes.
but this one partner is seeing multiple women,
Okay.
right? So that partner knows that partner is risky. So invites all those risks that he accumulates outside onto the patient or the person that he's with.
Okay.
Right.
All right. Now, what some persons would have known, like that multiple sexual partner would be the risk of getting like sexually transmitted infections such as gonorrhea, chlamydia, trichomoniasis, or even more severe sexually transmitted infections such as HIV. Right? So, why are you including cancer in the mix for multiple sexual partners as a risk factor for cancer? But normally we don't hear about cancer like smoking, drinking, older age, etc. But why are you including sex to relate to cancer?
Right, that's a very good question, right? Remember, 95% of cases of cervical cancer is due to the HPV virus,
Okay.
right? More than, some books will say 99%,
Oh.
right? But 95% of cervical cancer, it is due to high risk sexual behavior, and that usually comes into play when a patient, let's say,
Okay, so
infected
infected
with cervical, with HPV.
HPV. Okay. So are you saying that cervical cancer is probably 90 to 95 to 99% basically a sexually transmitted infection?
Yes, it is.
So what percentage of the population is infected with HPV virus?
And that now in our setting, you
Yes.
cannot know that because most time in Jamaica we don't take a some of the female vagina and send it for testing.
Okay.
So we cannot know in Jamaica,
Okay.
right?
All right. And so in terms of the HPV, is there any vaccine to prevent HPV virus from other contracting HPV virus?
Yes, there are actually very good vaccines out there. One such example is Gardasil,
Okay.
which helps to protect against HPV 16, 18, 7, and 11.
Okay.
Right? However, I must say that since the advent of COVID, a lot of persons are very, very when the topic of vaccine comes up, everybody tends to run,
Okay.
right? Usually when we're growing up as kids, when it comes on to vaccination, our parents will just take us to get vaccinated and everybody's good. But since the advent of COVID, nobody really wants to take vaccines. But the cervical cancer, the HPV vaccine is a very, very, very good vaccine.
All right. So which age group do we now recommend the HPV vaccine for? And do we recommend them to females only or both males and females?
Okay, so the age group from about 13 up to about 25, 26. And it's only for females.
Only for
It's
females.
only for females.
Okay. All right. Now, apart from HPV vaccine, is there any other means you can use to prevent cervical cancer in terms of, I know, like, for example, some cancer that I'm familiar with, like colon cancer, to use colonoscopy to help prevent it or screen early, or do we have any screening tests for cervical cancer and who often is recommended? Is it?
Alright, so let's just take it from the top.
Yeah.
In terms of prevention,
Okay.
right?
Sure.
Avoid risk factors
Yes.
as much as possible. If your partner is risky, get rid of that partner. Right? Yes, of course. if you have a ferocious sexual appetite, curb that sexual appetite, right? So once we mitigate the risk factors, we can mitigate the disease. Also, yes, there's a screening method for cervical cancer, and that is called Papsmear. It's a very simple test, and it is very, very, very sensitive. But the problem with that in our setting, right? A lot of females, they tend to shy away from it. We'll see them all, they're coming down with that. One mental thing inside of a channel. So hence why a lot of females, they tend to shy away from getting the pap smear, and I can't stress enough the importance of getting a pap smear. Like even here at VJH, a pap smear is done on Thursdays. It's free of cost.
Yes.
The only hiccup with that is that when the samples are taken and sent on to the lab, the turnaround time when we actually get the results, it's fairly long. And I assume that it's due to the backlog of cases that are at the government lab. But please, begging everyone, begging females, please get that pap smear done, right? It can and it will save your life. If we should go further on and to speak more on pap smear and screening method, they say in Canada, if you find or should find a woman with cervical cancer, they know that that woman did not grow up in Canada for most of her natural life. Right? Because over there in Canada, they have a really, really, really good screening program. So they know that if they discover cervical cancer in their population, they can point and say, hey, this person immigrated or just come to Canada maybe in a few years ago or something like that.
So how often should you advise females to get a pap smear? And at which age do they normally start getting pap smear?
They can start the pap smear, let's say at about 8. So
You're on a second.
yeah, once a woman is not sexually active, you would advise her to do a pap smear.
Yes.
But once she's sexually active, by about age 21,
Yes.
she can start getting a pap smear. It can be done every 3 years.
3 years.
That's how I'm set if you don't know the pap smears.
Okay. So you want to just use, I don't want this interview to be very long as I said before, but do you want to take a minute or two just to explain to the viewers how you do the pap smear and what they should do before they come so they can have at least an understanding?
Right. So the pap smear it's very simple. Alright. So sometimes what we use is something called a cycle rush.
Yes.
Right. So the female comes in, she's not on a monthly cycle. She comes in, she set a date, come in, right? And I say it is very simple. All that is done, the speculum is inserted into the vagina, right? Yes, it may be a little bit uncomfortable, but it's not painful, uncomfortable, right? So the speculum is inserted into the vagina. It is gently open. Cervix comes into view. The side brush is used just to get a few of those cells right from that cervical, they call it the transitional zone.
Okay.
Right? So we use the side brush, get a few of those cells, put it on a slide, send it off to the lab. It is very simple. It don't even take 5 minutes.
Okay, alright, so listening females, so definitely you should go and get your pap smear. If you can't afford to do it privately, then it's done free in the government system. Alright, now Dr. McNeil, so in case someone did not get their pap smear and did get their HPV vaccine and developing cervical cancer, what are some of the symptoms that a woman would normally have which can indicate that it may be cervical cancer? I should definitely seek medical attention as soon as possible.
See, sometimes the symptoms of cervical cancer, they're not obvious.
Okay.
So it may lead a woman to delay seeking medical attention because it could be just that, okay, she does having spottings.
Okay.
Frequent spottings are, so she might just think that, hey, it is as a result of her cycle.
Okay.
Right? She may just have, just a little lingering lower abdominal pain, and she probably think that, hey, I'm always getting an UTI.
Okay.
Something as simple as that.
Okay.
Right? But so in the first stages, right, it's not that bad. So you won't really know unless you say, okay, schedule the regular pap smears, we'll pick up the abnormal cells and then we can take it from there. But as the disease progresses, there'll be more problems, right? This woman may feel a mass inside the vagina, right? She may have a discharge, and the discharge smells really foul. And no matter how you treat with antibiotics, that foul smelling discharge is just not going away, right? That now should cue a woman to say, hey, this is more than just a discharge that's not going away. Let me go and seek medical attention from a gynecologist. Because a lot of times, in Jamaica, we may seek, Jamaicans are, we just want to stay with the GP that we know because, hey, my mom has been going to him, he is good, and I've been going to him from I was a baby. But no, once you see that general practitioner cannot get whatever problem you have under control, asking for a referral to see a specialist.
Okay. All right, definitely. All right. No, I had like some person that I detected at my office with cervical cancer. Actually, I think they had bleeding, especially after sex.
Yes.
No, it wasn't it. And I think that there was actually this elderly female postmenopausal, but normally we're thinking postmenopausal bleed can be endometrium, but it actually was cervical as well. So I'm actually certain that those two presentation is actually, you should look up a cervical cancer. So, all right. No, let's reach in the final section. So, say for example, someone is diagnosed with cervical cancer. What are the treatment options? I remember in no detail because
no details.
So, like, do they have to do surgery, do radiation, chemotherapy? So that's the line. Just keep it general.
So let's say the lady comes in, or she had an abnormal Papsmear, or let's say she do a test and she found out that, hey, I have cervical cancer, right, for the lady. First thing you want to do is stage that patient. You cannot start treatment without staging the patient, right? Stage 1, it's very simple to treat. Stage 1, so it's usually from stage 1 to 4. Stage 1, the earliest stages, it's easy to treat. Right? We may schedule a lady for what we call a colposcopy, meaning she just come in, use a camera, look at the cervix. We may remove a piece of cervix and send it to the lab for testing. So that's one form of treatment. Surgery may be an option. We may need to remove the entire cervix as well as the womb, right? Depending on what the stage is. Or we may just jump to chemotherapy and or radiotherapy, right? Because a lot of times before you can even get to surgery, right? If the tumor is too large, you may need chemotherapy or radiotherapy in order to shrink that tumor down before you can actually remove that tumor, right? So that as I said, the treatment is very straightforward. It's either once we get the staging, it's either simple colposcopy, just to remove that a layer of the cervix, or surgery or radiotherapy. Right?
Okay, Dr. Martin, well said. So at this point, I just wanted to give a summary of what was discussed today, like a minute or two, and then normally for the guests, I would ask them if they have a private practice or if they have any business to advertise, they can use this medium to indicate their address, their number, etc. All right? You can go ahead, please.
All right. So in summary, right, cervical cancer, it is prevalent, however, it is very easy to diagnose, right? What we can do in diagnosing that, it's a screening test. Do a Papsmear. Once that Papsmear shows that there's something abnormal going on, right? You visit the OBGYN. That OBGYN now will actually stage it, right? Staging is very simple, very, very simple, right? Once you get the stage, then you move on to treatment. I mean, I've just jumped the gun a little bit. However, I'm asking if you're in order to prevent cervical cancer, prevent the risk, stay away from the risk factors, right? So the multiple sexual partners, that's a no-no, if you have a partner that is very risky, I'm telling you, just get rid of that partner. Right? It may save your life down the line. Alright? Of note, not every time someone is infected with HPV, they may move on to develop cervical cancer. Right? Because the body is so good that I think they say about 80% of the time when a person contracts HPV, the body actually gets rid of the virus without you even knowing. Right? But however, if your body keeps contracting that virus over and over and over, right? So at some point, you know, the system is going to get overwhelmed, and the virus is going to slip through. It's going to cause some problems, and then you may just develop cervical cancer. Right? So get rid of as I said, the risky sexual behavior, right? That is somewhat now prevalent in society.
All right. As I said before, if you have any private office business you want to advertise, you can use this opportunity. If not, you can just
Well, I'm here at Jubilee. Right? You can always find me here at Jubilee. I have a TikTok handle. It's fairly new. Plan to start posting more of these videos. As I say, you're doing very good work, I must say.
Thank you very much.
At one point, you forgot to tell the viewers that, you know, we actually took the same path into medicine, where we did a degree at South. So then, now here we are as medical professionals. But, I mean, just have a TikTok handle for now. And if not anything, you can always show up to Jubilee. The doctors here will be more than happy to answer any of the questions that patients may have or anything like that. Or then you can even reach out to your page and, you know, you can pass the information to me, and we'll definitely allow the viewers to get some answers.
Okay, all right, Dr. Mackie. So, viewers, remember to share, like, subscribe, and leave a comment on this video if you found it informative. And also, we have other videos on this channel. We talk about different types of cancer. So, we had a patient story on this channel about breast cancer, which she told her story. We also had Dr. Taylor Falls, which did a nice video on colon cancer. So those are some other cancer videos that you can actually check out on this video. So until next time, stay tuned. Thanks very much for taking the time.
Remember, we're supposed to come back and probably talk about PCOS.
PCOS, okay, definitely, man.
Yeah.
Later on in the year, definitely come and talk about PCOS.
Be sure to subscribe for more informative contents on life, sickness, and death.